Good afternoon. Welcome to today's webinar Wednesday. My name is Sarah Ring. I am a speech language pathologist at Sanford Health in Fargo, North Dakota. I will be presenting part 3 of a 3-part series on the Rancho Amigos scale of cognitive recovery. Today we'll be talking about the late phase of recovery, or Rancho levels 7, 8, 9, and 10. I will share my screen and we will dive right into today's content. Where I'd like to share today's objectives. Whether you've seen parts 1 and 2 of this series or not, I will be reviewing some practical uses for use of this scale. I can't talk about brain injury without using this scale, and I hope that your rehabilitation team is actively using this scale and finds it equally as essential to the work that you do. If your team does not use this scale, I strongly encourage you to consider the information reviewed in this series in order to best collaborate and support in your work, support your team in the work that you do with individuals after brain injury. We will again be discussing specific characteristics of individuals at Rancho levels 7, 8, 9, and 10, and reviewing some video cases to reinforce the content. We will be discussing the unique aspect of awareness as it has to do with brain injury recovery. And then finally, we will be reviewing specific strategies that can support individuals at that late phase of recovery after traumatic brain injury. Now, please note that I said traumatic brain injury. I did not say acquired brain injury. The Rancho Los Amigos scale is applicable only to the traumatic brain injury population. It is not appropriate for use with individuals following stroke, anoxic brain injury, brain infection, or brain tumor. I'd like to review the Center for Disease Control and Prevention's definition of traumatic brain injury for use as a framework across today's presentation. Traumatic brain injury, as defined by the CDC, is a blow or jolt to the head or a penetrating head injury that disrupts the function of the brain. Of course, not all blows or jolts to the head result in a TBI. And TBI ranges in severity from mild to severe. Finally, a TBI can result in short or long-term problems with independent function. We will be discussing all aspects of that definition during today's presentation. First, let's talk briefly today about severity of TBI. It is current practice to define injuries to the brain of a traumatic nature as either mild, moderate, or severe in nature. I'm not going to review the individual distinctions among the categories listed on this slide. Please feel free to use this slide as you educate new staff or educate patients and families about brain injury. This is a user-friendly slide with lots of good information. But the biggest takeaway that I would share today is that severity does not equal function. In other words, just because someone was diagnosed with a mild traumatic brain injury does not mean that they only experience mild deficits following those injuries. We certainly have all likely seen individuals following mild TBI who experience debilitating deficits as a result of their injury. So certainly, that is an essential principle to keep in mind as you consider severity of TBI. Prognosis following TBI. Research has identified multiple factors that assist healthcare providers and rehabilitation teams in determining an individual's prognosis after TBI. There are factors related to the injury itself, most significantly location and severity of injury, that play a major role in determining prognosis. Certainly, as we talk about the pediatric population, knowing age at injury is a critical factor, and knowing that injury that is sustained earlier in life is not in that child's best interest. And most often, children who experience traumatic brain injury live with lifelong consequences of those injuries. There are also prognostic factors that an individual brings to their brain injury. What kind of brain does the individual bring to a TBI? Those are important questions to ask because they do help shape recovery and prognosis after TBI. So factors such as premorbid intelligence, psychosocial factors, pre-existing conditions, things such as socioeconomic status or substance abuse, all of those factors certainly negatively affect one's prognosis following TBI, as does an individual's history of previous brain injury. Those are all important questions to ask during information gathering, during initial interviews, initial evaluations. Certainly, as you continue to work with this individual after their TBI. Now, the Rancho Los Amigos Scale of Cognitive Recovery Revised, or the RLA-R, can also assist in determining prognosis. This particular scale was developed in 1972 by healthcare providers at the Rancho Los Amigos National Rehabilitation Center in Downey, California, again, back in 1972. The initial scale had 8 levels. There was a minor revision in 1974, and then an additional revision in 1997 when levels 9 and 10 were added to better reflect those highest levels of recovery. Now, the scale was developed based on the assumption that by observing patient behaviors and noting type, nature, and quality of behaviors, providers could estimate level of functioning across one's recovery after brain injury. The scale was then developed and presented as behavioral descriptions in a narrative form, such that a rater would be able to observe a patient and utilize the scale to identify what behavioral descriptors were being observed and identify patients as functioning at particular levels on the scale. Now, not only am I a big fan of this scale, but research has certainly reinforced the benefits of the use of this scale for brain injury rehabilitation teams. There are various practical uses for individuals who support survivors of traumatic brain injury. So let's talk about some of those. First, use of this scale provides your team common language. Whether you are a physical therapist, a social worker, a speech language pathologist, using the same terminology allows your team to enrich and enhance your observations within your sessions, within the patient's room, during meal observations, and allows those team staffings and any other types of communication among the team to be enhanced by the specific use of this scale. This scale is also beneficial in guiding rehabilitation planning. Understanding the level at which a patient is functioning is critical for team members to plan for environment, task complexity, and to determine safety. This scale also assists the team in predicting outcomes and evaluating recovery after TBI. This slide provides you an overview of levels 1 through 10. Part 1 of this series was a review of levels 1, 2, and 3, or that early phase of recovery. Part 2 was a deep dive into the middle phase of recovery, or levels 4, 5, and 6. Today, we will close today's series by describing typical characteristics of individuals at Rancho levels 7, 8, 9, and 10, or again, individuals in that late phase of recovery. Now, in general, this slide provides an overview of goals for a rehabilitation team. Goals in which we strive to decrease one's dependence on structure that we have worked so hard to establish during the early and middle phases of recovery, and now pulling away supports, and with the hopes of increasing one's independence for tasks within the therapeutic environment and or upon discharge to post-secondary phase of recovery and potentially therapy or residential living, wherever that may be. These goals apply for individuals in Rancho levels 7 through 10. It's within these levels that we can start to support the development of one's awareness or insight into the consequences that they may continue to struggle with after their traumatic brain injury. Of course, we are hoping to continue to build on cognitive skills during the middle phases of recovery. We supported individuals with simple or basic tasks and supported them with a variety of methods of compensation. It's at this later phase of recovery in which we continue to address cognition and potentially higher levels of cognitive functioning as able. It is at these levels that an individual may likely be returning to school or work, and supporting an individual to return to such activities with accommodations is likely critical, and certainly within the scope of many of us who do the work with brain injury. And of course, education. It's at this level, it's at this late phase of recovery in which individuals are able to comprehend and remember brain injury education information. Excuse me. So in general, when interacting with an individual at these later stages, the idea of encouraging initiation and independence with basic routines and various tasks in therapy sessions or routine tasks within a living environment. Encourage decision-making, providing those choices. Certainly supporting one's ability to manage complex activities of daily living, such as management of finances, medications, and appointments. Continuing to use normal language, and certainly defining and providing clarification with language as needed. Individuals will be able to participate in outpatient programs potentially at this point, and home programming tasks are critical to facilitate carryover and reinforcement of strategies and skills addressed in therapy. Certainly encouraging use of compensatory tools, monitoring for fatigue and overstimulation. A recovering brain has to work harder. And so encouraging an individual to become more independent with monitoring their fatigue and using strategies trained in sessions with various providers to manage the same. And then finally, increasing awareness of deficits. And so at this point, I want to talk a little bit about that, about awareness, or a term that we call metacognition. According to Merriam-Webster, metacognition is defined as awareness or analysis of one's own learning or thinking processes. I explain it to my patients as thinking about your thinking. It is at this late phase of recovery in which individuals become more capable of consistently thinking about their thinking. In the early and middle phases of recovery, awareness is impaired. Individuals are often in post-traumatic amnesia and unable to recall the fact that they had a traumatic brain injury or any types of compensatory strategies that healthcare providers and therapy teams are hoping to reinforce. As an individual progresses across Rancho levels and emerges into those later stages of recovery, individuals are able to develop various levels of awareness. At the base of this particular pyramid is intellectual awareness. So this is the awareness that a patient has, that they understand that they had a deficit, but they're not able to reflect on the implications of that injury. So one might say, I had a TBI, and in the next sentence, say, I'm ready to go home and drive my car. So again, being aware that an individual has a deficit, has had a TBI, but not aware that the complex processes involved in following a TBI may affect their ability to safely drive their car. At the next level of the pyramid is emergent awareness. At this level of awareness, an individual has awareness of the problem as it is occurring. So, for example, for a patient who may have decreased emotional regulation and is disinhibited, he or she may note in the moment when they begin to spew obscenities at their therapist, but not able to stop themselves before the behavior happens. It should be noted that at this level of awareness, this level is critical in order for any patient to be able to implement compensatory strategies that are being reviewed and reinforced in therapy. One must be aware of the problem and its consequences to be able to understand the need to compensate for it. Finally, at the top of the pyramid is what we term anticipatory awareness. At this level, an individual can anticipate that a problem will occur before it happens and plan a strategy to ensure success or minimize behaviors. Again, at early and middle phases of recovery, awareness is impaired. It is only at the late stage of recovery, Rancho levels 7, 8, 9, and 10, that an individual can start to exhibit intellectual awareness, emergent awareness, and hopefully anticipatory awareness. It's through the strategy training with outpatient therapy programs and structure and routine at residential facilities potentially, or support from family in that continues to build awareness over time and allows one to be more independent with use of strategies. This will make a little bit more sense as we talk about each of the levels individually and to be able to understand the distinction between these late stages. So first, Rancho level 7, or automatic appropriate stage. At this stage, most daily activities are done automatically, but almost robot-like, almost automatic. Concentration, judgment, problem solving, those higher level skills remain impaired, and so safety remains a concern. An individual may feel better, but again, that lack of awareness potentially can place an individual at increased safety risk. Individuals may be rigid in their thinking and certainly lack realistic planning for their future. At Rancho level 7, individuals are more consistently oriented, particularly within highly familiar environments. Individuals are able to participate over time in therapy sessions with only minimal support for sustained attention. Ongoing support for memory, new learning, and higher level cognitive skills is required. I'm going to stop sharing my screen and share a video clip of an individual at Rancho level 7. Where did she go? Here she is. All right, let's try this. We'll just listen for a clip here. Okay, I'm going to stop sharing there and go back to our PowerPoint. So in that particular clip, I am certain that you identified various characteristics that we talked about for individuals at Rancho level 7. She demonstrated that intellectual awareness. She was able to say that she had a traumatic brain injury, but her judgment was impaired, unrealistic, thinking she could return to work, return to school, not necessarily considering the other physical and cognitive consequences of her injury. Supporting an individual at Rancho level 7 can look like this. Again, we're encouraging independence, but ongoing supervision up to 24 hours may be needed for an individual at Rancho level 7. Certainly, with supervision to ensure safety and those types of things are critical. Ongoing participation in a rehabilitation program would be essential for someone at this level of functioning, where practicing simple tasks with routine and structure could over time be advanced to managing behavior, memory, and higher level skills, which an individual may require support with for months or years to come. At Rancho level 8, an individual has more independence and is purposeful in their daily routine. Individuals are consistently oriented to person, place, time. An individual can attend and participate in activities over a longer period of time, even in the presence of distraction. Memory skills continue to be enhanced and advanced and supported with more consistent use of compensatory memory strategies. Awareness continues to emerge. However, ongoing support with decision-making, particularly for complex tasks, is required. Individuals may overestimate or underestimate their ability to perform high-level tasks. I would like to show, I'm going to stop this again. And we're going to find one other video clip to illustrate for you someone at Rancho level. Let's see where I want to go with this one. Maybe, I think, let's go right here. Okay, so this is an individual at Rancho level 8. Okay, okay, I'm going to stop that. Okay, all right, I'm going to close out of that and go back to our PowerPoint presentation. Let's go here. All right, so again, you guys are becoming pros at this. I know that you identified that individual's intellectual, emergent, and even anticipatory awareness when it comes to the level of support that she needs for her persistent memory impairments. However, she was somewhat rigid and underestimated the, as she talked about school, certainly was more concrete with doing her goals being getting the assignments done rather than the end goal, talking in general about the end goal. So just much more concrete in her language about that. Supporting someone at this level of recovery, we know we can encourage use of compensatory strategies. We talk about compensatory strategies being things that are either internal or external in nature that can support one's cognitive skills. So an individual may require a daily planner. An individual may require alarms on the phone, as that last patient discussed. Individuals may require support with use of those compensatory strategies. Encouraging participation in rehabilitation programs is encouraged, as well as support groups or other community activities, socialization, all of those opportunities to enhance physical and cognitive skills following brain injury. Providing ongoing support and feedback and encouragement and education to shape one's success with use of strategies. Finally, we'll talk about Rancho levels 9 and 10. These are those highest levels of recovery that were most recently added to the scale. And individuals at Rancho levels 9 require only standby assistance upon request. Individuals demonstrate all levels of awareness, and are often able to perform independently and use compensatory strategies with a high level of independence as well. Individuals are able to self-monitor appropriateness of social behavior and other skills with standby assistance. I am going to stop sharing one more time and give you an example of an individual at Rancho level 9. Go. Where are we at here? We are, oh, I closed out of him, didn't I? Well, you know what? We're not going to take the time to do that. The particular clip that I intended to share was an individual who was able to reflect on his recovery. Let's go here. Slide. All right, so this particular individual was sharing his recovery story, the fact that he had resumed independent living, he was able to drive, he was able to get back to work, but discussed the various methods of compensation that he used in order to be successful. This individual shared his use of external memory strategies and organization strategies. Again, a daily planner, a calendar, a to-do list, as well as other sorts of compensatory strategies to manage cognitive fatigue and reduce overstimulation. He talked about that in terms of safety with driving and accuracy with work. Similarly, individuals at Rancho level 10, or what we term modified independence, are able to handle multiple tasks simultaneously. Individuals are independent with initiation of tasks, but may continue to require compensatory strategies. Individuals demonstrate appropriate awareness of their deficits and how those may impact activities of daily living. Social interaction is consistent and appropriate at Rancho level 10. And so we have it, the phenomenal concept of neuroplasticity allows us to talk about individuals at Rancho level 1 who are unresponsive, in a coma, total assistance, and all of the other various behavioral characteristics that we see along the continuum of the Rancho level scale because of neuroplasticity. It's phenomenal. And this scale helps us keep that in perspective as we talk about brain injury, as we support individuals with brain injury. It allows us to use the same language with all of our team members, including the patient. And it helps guide planning and programming. It helps individuals identify what is typical. It helps families identify that behaviors are typical at various levels of recovery. And it allows teams, families, and patients to evaluate recovery after TBI. I challenge you, if you are a survivor on this webinar, to consider where you were on the scale. Where are you today? And we've talked about that in other presentations within this series, that individuals definitely vary between levels, and what factors allow you to perform as best as possible on the scale, and where is your lowest level potential level on the scale, and what type of behaviors and methods of compensation and modification do you need to do to help you support yourself to achieve the highest level of functioning that you possibly can? Again, not all individuals start at level 1 and end at level 10 after traumatic brain injury. The goal is just certainly to support individuals to achieve the highest level possible. And this scale allows us to have the language to talk about that and understand that. With that, I will close out this final session of this 3-part series. Thank you so much for joining me for this series. My contact information is on the slide. Please feel free to reach out with questions or comments. And best of luck as you continue to navigate brain injury rehabilitation.